Good evening. Welcome to this KPCC and LAist virtual conversation about kids' mental health and the pandemic. I'm John Cohn, and I manage live programming and events for KPCC and LAist. I'm also a dad, so I'm very much looking forward to tonight's program. Thank you, everybody, for joining us. All of the programming on KPCC and LAist is made possible by the generous support of our members. Thank you to all of you. If you're in a position in which you can give, you can visit us online at support.kpcc.org/in-person. While you're there, sign up for our events newsletter to stay up to date on all of our upcoming events, virtual and in person, including our year-long Public Radio Palooza series featuring the public radio shows and creators that make the magic happen. Throughout tonight's event, if you have a question for the program participants, please put it in the chat of the platform you're watching on. A live text transcript of the program is also available on our website just below the chat box. Given the nature of tonight's topic, our program may contain discussion of sensitive subject matter, so we do encourage viewer discretion. Without further ado, please welcome Senior Health Reporter Jackie Fortiér and Mental Health Reporter Robert Garrova.
Hi, I'm Jackie Fortiér. Experts, officials, and political leaders across the country are really drawing attention to youth mental health like never before. The Children's Hospital Association, the American Academy of Child and Adolescent Psychiatry, the American Academy of Pediatrics, the U.S. Surgeon General, and now President Biden, as part of his State of the Union messaging last night, have all pointed to what many believe is a worsening mental health crisis among youth. Some of the statistics are a little disturbing. According to the Children's Hospital Association, in the first 6 months of 2021, children's hospitals across the country reported a 45% increase in the number of self-injury and suicide cases in 5 to 17-year-olds compared to the same time period in 2019. Many believe this crisis predated the pandemic, and now we're just starting to put together the pieces of how COVID-19 has affected youth mental health. We're hoping to make some sense of our current moment with our guests this evening.
Yeah, and we should note that today is actually Teen Mental Health Day. So a little note on our programming. We'd love to hear from your questions towards the end of the program, and we'll pass them along to our panelists. Our panelists tonight are Tegan Henke, Senior Director of Program Implementation for Child and Family Policy at the Meadows Mental Health Policy Institute. We have Stephanie Murray, school psychologist at Whittier Union High School District and Mental Wellness Committee co-chair of the California Association of School Psychologists, and Dr. Shilpa Taufique, Director of the Division of Psychology at Mount Sinai Health System in New York. Thanks so much to everyone for joining us tonight. We really appreciate it.
Glad to be here.
Thanks. So we're gonna start off with a big one here. And this goes out to all of our panelists. What kinds of new mental health challenges for youth are we seeing since the pandemic?
I can jump in if that's all right. I think we're hearing the overview you gave at the beginning, Jackie, was spot on. We're hearing so many worsening crises among children and youth. So what we saw present prior to the pandemic, we're continuing to see, except tenfold and worse. So we're seeing more cases of PTSD, depression, anxiety, and more severe too. So it's really just grown exponentially, as from younger children presenting earlier all the way through teens. We're continuing to see some really serious struggles.
And I'll add to that, specific to post-pandemic is an incredible amount of grief as kids and families have been losing loved ones and friends, and it's at unprecedented levels really that they're experiencing this grief along with their own struggles with mental health.
And if I could add to that, in schools, we were seeing increases in needs in mental health for youth prior to the pandemic. There was so much polarization in the country, and we were seeing increasing need. And then everything was exacerbated during the pandemic and the shutdown. We're seeing increasing rates of depression. Suicide rate has been steadily increasing since 2007 and then has grown greatly during this time. We're seeing increases in anxiety and again, that incredible grief that our youth are feeling.
Yeah, I'd like to talk a little bit more of kind of the evidence-based. I mean, is there enough like data to start making assertions about how COVID has affected, kids and teens. We can look at, hospitalizations, kids maybe getting more counseling, but I'm curious, how you measure that in like individual children and what you can use to look at that.
I think some things that we've used are, looking at, of course, rates of emergency department usage. So, we do have data to be able to show that we're seeing more and more children and youth presenting at emergency departments in crisis. And then we've used a lot of school data. So, both like schools can report, and I think Stephanie could say more about this, but the number of referrals that they're getting to their counseling department for outcries or observed behavioral health needs in classrooms. So just increased referrals, behavioral needs, things like that. So there is some real data to support what it is that we're hearing from caregivers and children and youth themselves.
And I think Tegan said it very well. Other things that we can look at are increased calls to hotlines. There is evidence of significant increases, for example, to Teen Line, which is geared specifically towards youth and adolescents. And again, those visits to emergency rooms in our districts, we're seeing a vast increase in the number of suicide risk assessments that we're doing. And not just, I'm in a high school district, but in some of the other districts that I consult with and work with, elementary districts, they're seeing large increases in the number of students they're seeing to do those assessments.
Yeah, and similarly in New York City, throughout the Department of Education, just keeping it at schools, which is where I think we get so much of the data in terms of referrals needed for mental health services and also referrals needed for in-school services. The numbers are getting so high that it's been very difficult for the schools to keep up. And as a mental health provider, I know I can attest for several programs within New York City, they're inundated and they're overwhelmed. And these are unprecedented numbers as well. We've never had wait lists as long as we have now. And having a wait list in the field of mental health is not a comfortable place to be. So it's really hard to know that we're kind of squeezing every bit of resource we have. And yet we're not able to meet the need.
I had a question that I think comes kind of out of that. What do we know about, the availability of beds or other services for kids who need immediate psychiatric care? I know the Biden administration just yesterday, they outlined some of their strategy to address mental health. They pointed to a nationwide shortage of behavioral health providers. It's even surfacing in pop culture. One of the most recent episodes of Euphoria, say what you will about that show, but there's a heartbreaking scene where a mother is on the phone, trying to get, the main character a psychiatric bed, and she's being told that it's just not available. I wonder if you have any thoughts on that, just, what's out there?
It's very limited. There has always been a shortage of beds, to be honest, even prior to the pandemic, and it has gotten worse. In LA County, there are only 5 hospitals that have beds for children between the ages of 12 and 18, and only 2 hospitals that take children under 12. So there has always been a shortage, and now it's gotten even worse. I'm told that children who go to emergency rooms, such as Children's Hospital Los Angeles, can wait from 24 to 72 hours to get placed. And if they have private insurance, there's still a long wait. And then if they have Medi-Cal and they're uninsured, it's even a longer wait. And in addition to that, we are seeing really our county mental health agencies that come out to the schools and do assessments once we've identified that a student may be at risk and may need that. We don't write the holds. They are the ones who come and do their final assessment. And they are very strained because there are not enough of them. And so there are very long wait times for that. And then again, as Shilpa mentioned before, the long wait times for students who may not need immediate hospitalization, but need care pretty quickly, there are long wait lists everywhere. Now in our area for the waiting for therapy, we do tend to have shorter wait times for students who have Medi-Cal and or are uninsured than for students with or children with private insurance. But it's, again, with mental health, you don't want to have a long wait time.
I just want to jump in on that. One of the things too, I think that you said quite nicely. So there's a shortage of beds, yes, but then there's also the shortage of capacity in the outpatient system. So, really when we're looking at hospitals, that's the last place we want to send children and youth. That's not a great experience. They get the care that they need. And so for youth and children who need that support, we absolutely want that resource to be available to them. But if we can catch what those needs early and provide some community-based services, that is ideal. And so when the community-based services, when there's a long wait, when there's kind of a lack of effective treatments available within the community, that's where we see the crisis situations exacerbating and getting to the point where you need the hospital as the first line of treatment, as opposed to accessing treatment and care earlier on before it has reached a point of crisis.
I think that really transitions well. I was hoping that Shilpa, either you or Tegan, could describe the CARES program and how it works, and the idea of these wraparound services. It's something that California is really trying to emulate.
Sure. Yes. So CARES is the Comprehensive Adolescent Rehabilitation Education Service. It's based at Mount Sinai in New York City. And we are a unique partnership with the New York City Department of Education and the hospital. And we provide an intensive treatment for teens with significant mental health and or substance abuse issues. And so these are really teens that have not been able to make it in the regular high school system. And they come to us from all around. They may come from the schools, from outpatient providers who realize their patients need a higher level of care. They'll come as a step down from inpatient units, whether psychiatric or substance related. We'll get referrals from the Child Protective Services, the juvenile justice system. And when they're with us, they're there all day long. So it's a full school day, 9 to 3:30. And we have Department of Education teachers on site with us at the hospital. So kids don't live there. They go home at the end of the day, but they come for a full school day. They work toward a full Regents diploma while having therapy infused throughout their day. So every student gets twice a week individual therapy at minimum, once a week family therapy, psychopharm management, 5 days a week of group therapy. And then we do milieu therapy very uniquely in that we staff our milieu with licensed clinicians who can do really on-demand, in-the-moment therapy for kids as they're struggling in the classroom. So kids can opt out of class anytime they need to and have access to an immediate therapist to help coach them through the moment, use some skills, identify what their needs are to be able to get them back into the classroom. And our success rate is quite high. We treat some of the most in need teens that we have in the city. And the level of intensity that goes into the service that we provide is not something that can happen in all schools. I also wouldn't promote that this happen in all schools. This is really meant for a slice of life when you're really struggling and you need this level of care. And the goal is to step them down to a regular school where there can be a more average level of supports available.
I'm curious too. I mean, the program sounds amazing and like a dream that, should be emulated in a lot of places so that access is available. How do you get kids? I mean, you mentioned a few places that kids get referred into it, but could you take us like a little bit closer into that process? Because I think it's always that kind of trigger point where we, decide that someone needs help and then they can kind of get into the system, but that's so difficult.
Sure. So there's some usual obstacles that come into place with a program like this. Typically you'll find this level of care in a day treatment program. And we've consciously chosen not to be designated as a day treatment because there are more requirements of the student or of the patient before they can be admitted. And we didn't want that. For example, in New York City, in order to be in a day treatment program, you do need an IEP, an individualized education plan. And half of our students have them. Maybe all could qualify, but they don't all want them. And we didn't want to have to put the families through the process of having to obtain one just to get the services. So we've had to fight back. For many years, we were fighting that the fight's no longer happening to become day treatment. And so we're just really an outpatient level of care, but we've designed it in such a way that we're meeting the needs of the specific patients and students that we have. We're trying to make the process of getting in as streamlined as possible, but given what a high level of care is, there's a good amount of information we need to get. So we get most of it in the intake process. So there's an application that anybody can access from our website. They can call and get it, and they just give us some basic information about what makes the student eligible. And then we do a quick turnaround of a review, get them in for an intake, and get them assigned as quickly as we can. Now, this is where the recent shortage of providers and also spots is really coming to be a problem for us, because I've got as many kids on the wait list as I do in the program at this point. And that's really disconcerting for me, knowing how many kids are waiting. So that, Robert, you bring up that scene in Euphoria, that just rings so true. When I saw that, it was kind of heartbreaking, because I thought, well, okay, now everybody gets to see what this is like. Only those parents that have to go through it really know. And the providers on the other end who aren't able to kind of grant these requests right away.
Yeah. It kind of brings me to, not to talk about another thing on top of another thing, but, we had the pandemic, we had, all of the fallout from that. Now we have a war.
Yeah.
I know, Stephanie, we've talked about this before, but how is this latest development affecting kids? What they see and what you're seeing in the day-to-day is my question. And I guess I'll go to you, Stephanie, because I know we've talked about this at least a little bit.
Right. I mean, there's so many layers of anxiety that our kids are feeling. And it's as I mentioned before, there was so much polarization before the pandemic, and then the pandemic happened. And so everybody was, everyone was focused on mental health with that. And then returning to school, which a lot of people thought, oh, everything's going to all of a sudden get better when kids come back to school. But a lot of us knew, even when a change is something that you wanted, it's not, it still causes anxiety. I could say so much about that, and I don't want to go on and on forever, but the anxiety that kids feel when, they had to get used to a new way of learning, and then they went back and had to get used to another new way of learning that was new to them. And we can go more into that later, because I do want to address your question. And now we add a war into that. And it's on people's minds. I mean, I was walking across campus yesterday, and I saw 3 young teenage boys talking about the war and talking about what was happening and talking about politics, which you don't usually on a school campus hear that. But it's on people's minds. I hear with my daughter, who's in middle school, and she's been talking about it. There's a lot of anxiety related to that. What is going to happen? There's a lot of uncertainty. There's a lot of heartbreak. I mean, it's on everyone's minds, as understandably so. I'm hoping that we'll see some compassion, which I think we are seeing, as well as the trauma. And a lot of parents want to know, well, how do I talk to my kids about this? What do I say to my kids? Do I shelter them? Do I not say anything? The fact is, kids are hearing about it. So I would say, listen to them, be a good listener, find out what they know. Let's not traumatize them with information that is not developmentally appropriate. We want to really focus on what's developmentally appropriate. Ask them what they've heard, and then you can address that. Sometimes they don't want to hear additional facts. They just want to be heard. They just want to hear, they want to air their fears. So we could, be armed with all this information, and all they wanted to do is be listened to. So I would say that the best thing we can do is be a good listener, answer their questions honestly, but not in a way to traumatize. We don't want to lie to them, because our kids need to know that they can trust us. We don't want to falsely reassure them. But we do need to acknowledge the elephant in the room, that everybody is, and I'm not trying to minimize it by calling it an elephant, but it's something that's on everyone's minds, and they're very concerned. So we need to really be good listeners and be supportive, and really listen to what they're saying, as well as what they're not saying.
That reminds me, I was in middle school when 9/11 happened, and I remember feeling very I grew up in Colorado, so it was very geographically separated from it, but you know, I was just very scary. And we had a lot of questions, and I think we sat around in jazz band and we just asked our director questions that day. We didn't play anything because it had happened that morning. And that was reassuring, and we were able to ask him questions, and we felt, I think, a little bit better. I am curious, though, to kind of explore the idea of going back to in-person school. So many people thought that that was just going to be a silver bullet, right? We get the kids in the classroom, and wearing masks, fine, but then they'll go back to normal, and it really just seemed to have a silver bullet kind of mentality. Stephanie, I mean, you're in the classroom. I'd love to hear from you, but of course, everybody else on the panel. What happened? And it seems like it wasn't a silver bullet.
I think a lot of people hoped it would be, but a lot of us kind of knew that it probably wouldn't be, because it's adjustment always causes stress, right? And so everything is different. You know, when they went to distance learning, they engaged with school in a different way. They engaged with their peers in a different way. They engaged with their teachers in a different way. And then coming back, it's not like you can just snap back into how it used to be. Everything does not go back to normal. And, you know, it hasn't gone back to the way it was before anyway. But still, even if it had, things just don't snap back into normal. There's an adjustment time. And so, and on top of that, you know, of adjusting to the new environment, and think about when kids make transitions to different schools, either they moved and went to a new school because there were a lot of things that happened maybe to families financially that they needed to move and were attending another school. We also have our children that matriculated from elementary to middle school or middle school to high school. So maybe they started their new school online. So they've never been on this campus before. It's very unfamiliar, and they're having to get used to that. They're having to get used to answering or asking questions of their teachers in a different way, and that a different way from what they've done for, you know, a year and a half prior to that. It's almost like a lot of kids forgot how to socialize. You know, in the first few months on the return, we saw a lot of fighting because kids weren't remembering how to interact in person anymore. And then on top of that, there was the intense feelings of loss that a lot of kids experienced, the anxiety with coming back to school, not just the change, but am I going to get sick? You know, am I going to make my family sick? There's so many layers that we don't know. We don't necessarily know what's going on in every kid's home. And you know, do they have a vulnerable family member at home? And so there might, and things like mask wearing has become so politicized, vaccination has become so politicized that kids are having discussions, and somebody's, you know, choice to maybe observe what was mandated or not can impact a child's feeling of safety, not just for themselves, but for potentially vulnerable family members they have at home. And so it's really complicated to identify all of the layers that we're seeing. We're seeing much more anxiety. We're seeing much more depression. And so we're really needing to meet that need. And we've been planning for this. We knew that this was going to be likely. And so we've had some time to sort of plan some interventions to have in place, but you can't always know what's going to happen until it happens. And so there's still a lot more that needs to be done in terms of supporting our children.
I think one additional layer that is in there too is the way staff and teachers were affected too. So you also have staff, teachers, you know, everybody in the school system, all of the adults there who are there to support the children and youth have also been affected by the pandemic. They are also experiencing depression, anxiety, grief, and loss, and perhaps vulnerable health compromised individuals too. And so, just saying that we're asking people who are hurting to help children and youth who are hurting too. And so when we're talking about responding to children and youth, we also have to support the adults who are supporting them as well. And so I think that's an important layer to this whole puzzle as well.
So how should we support the adults who are supporting youth? Like, what would you like to see in schools, for somebody like Stephanie, who is doing this work? And I mean, the other teachers too. Like I just said, my jazz band teacher became our counselor that day. He was not prepared for that. He did the best he could.
Yeah, I mean, I think it's, what we've been hearing from teachers. I think for a long time, we've been talking about like self-care. And, the fact is you can't really self-care yourself out of what we've been experiencing in the last couple of years. And so having real, resources for teachers, and I think listening to what is it that they need. And so what would be helpful? Do they need more time during the day? And I know we're all stretched for resources. So some of these may be difficult requests, but, do they need more time so that they can reach out to parents and caregivers and talk about what's happening in the classroom, instead of doing it like on their drive home or calling caregivers in the evening? Do they need more days off? What would help them feel supported? So part of what you could do, and it might vary from district to district, but I think really asking the school staff, what is it that you need? What would make you feel supported? And we have heard that taking more time and having more time to do those like non-academic things like reaching out to caregivers would be something that would feel supportive.
One thing we've done at CARES that's really just kind of at the backbone of how we run is that we treat teachers as junior clinicians and clinicians as junior educators, meaning that we cross-train, not to have clinicians actually teaching, but to understand what is it like to be an educator for students like this, and what goes into being an educator, because sometimes the approach and the needs of the clinicians and the educators can be in conflict. But if we can understand what each other is doing, we can better support each other in doing this. And we've just woven into the fabric of how we have to work there that a big part of what we do is support each other. And so I think that is a model that does need to be replicated across the board. We need to have more clinicians and social supports in the schools, not only for the students, but for the school staff and the educators that are working with the students. They're vicariously taking in what the students are going through, and they need help in understanding how to keep on track with what their goals are, but also process this information that they're getting inundated with, and how do they be that jazz teacher for their students who can juggle both things that are coming at them. And I think, I hear so many times, how about if I just add more social workers and then all the kids can get a therapist? That's not going to do it. That's not addressing the needs of the caregivers in the schools. They have to be cared for as well.
I like that, Shilpa, like a culture of care.
Yeah, exactly.
Is what you're describing,
exactly.
Right? I like that, yeah.
I love that. Those are amazing thoughts. And I think, if I could just add to that, I think also when we approach educators, assuming good intentions.
Yes.
Really, because educators are in charge of a lot. They've been given a lot of responsibility. They're asked to teach our youth. They're asked to take care of them, protect them. They're in charge of their health and their safety and their welfare and their psychological well-being, in a sense, because we're asking them to look for warning signs and refer kids. And teachers also and educators get blamed for a lot too, when they're having to implement rules that are for the safety of all, and they're being blamed when they had no control. They didn't make them. They're implementing what they've been told to do. And I think that if people can approach educators knowing and assuming good intentions. I mean, we didn't get into education because we want to get rich, that's for sure. So we did it because we truly care about youth, right? And we want to help them, whether we're teaching them for the teachers or whether we're doing, what I do as a school psychologist. But we got into this because we want to help children. And if people can remember that, and so when we're being approached with concerns or requests, it all works better. And the same as we're being approached by others, if we assume good intentions as well too. It just makes for a much more productive interaction because really we're all on the same team. We want what's best for the kids.
I was having a conversation with my 11-year-old niece this morning, and she asking her about school, how it was like, what it was like being back. And she actually made the comment, we were talking about her teacher, she just got a new teacher. And she said, you know, it's really hard to be a teacher right now. And I was just really struck by that. And I think it's, you know, everybody knows. So the students recognize what a difficult position teachers are in, and maybe my niece is unique in that way, but you know, I think it's really felt across the board. And so I think we need to, you know, recognize that this is something that we're all seeing, and we all want to be supportive.
I don't know how teachers are feeling about TikTok. I can imagine some of them very much like it, or maybe, you know, or stars themselves, or I don't know. But and this may be an entirely different conversation and a whole conversation to itself, but it's a little bit newsy. So I'm going to mention it. The California Attorney General Rob Bonta announced just earlier this afternoon that he was launching a nationwide investigation into TikTok. I'm quoting from the press release. The investigation will look into the harms using TikTok can cause to young users and what TikTok knew about those harms. The investigation focuses, among other things, on the techniques utilized by TikTok to boost young user engagement, including strategies or efforts to increase the duration of time spent on the platform and frequency of engagement with the platform. So, you know, it's not just about TikTok, but I wonder how our panelists, you know, think social media has affected kids throughout the pandemic, and, you know, with the war going on in Ukraine now, how that might be affecting them, you know, through TikTok or other platforms now.
You know, I bet Stephanie has a lot of experience seeing this with youth specifically. But, you know, one thing that I'll just say, just from a access point. So, you know, social media, I think, can be a great connector. So it can be a great source of information to find resources about mental health, find support, reduce stigma. But it also has so much information that it can be hard to discern what is a trusted source and what is, you know, what worked for somebody doesn't work for everybody. So getting towards like evidence-based treatment, evidence-based care, and understanding that social media and finding resources on social media does not equate treatment, and it doesn't replace treatment and access to care. And so I think, you know, just kind of, I don't have any solutions to that, but I think just sort of that awareness that while it can be a tool for, you know, accessing resources and maybe feeling less isolation, it also, you know, doesn't replace, you know, actual treatment and evidence-based care.
Yeah, I'm having my own emotional battle with how I feel about social media, but I will say it's almost, you know, a double-edged sword, because there is so much access to not reliable information, and people sometimes think that if they see it, it must be, you know, if they read it on the internet, it must be true. And our kids, especially, as their brains are still forming and as they're still learning things, they, if there are any kids out there, I apologize, but they're not always able to use the best judgment in really kind of figuring out what's reliable and what isn't. And it's constant access. That's the thing also, it's constant access. So that really concerns me. But on the other hand, we want outlets for kids to talk, and kids have gotten so used to not talking in person. We want them to have the outlet to be able to express their feelings. But I would hope that if they start that conversation, then someone gets them to bring it to an adult, a therapist, a school psychologist, school counselor, that they can talk about their feelings more in depth in a healthy way that's going to lead to treatment.
And I get really worried when I mean, everything you're both saying is absolutely spot on. I get worried when we get into this polarized adults versus kids and social media, and because that's going to take us nowhere but in trouble. And it makes me think, you know, we need to approach this differently now. It's here to stay. It's not going anywhere. And maybe there will be some random regulations and monitoring and whatnot. But I think what we can best do is teach our kids how to use social media now that we have a sense of what it is. And so I'm thinking even we need a new mandatory class in school education around how do you critically utilize social media? How can you do it in the best way possible, the smartest way possible? And if we can start teaching kids to look at it a little bit more critically than just assuming whatever's there goes. And so many too turn to social media because they don't have adults to guide them in the way that they need to. And that's, that's not a judgment. It's just sometimes just a fact that has to be dealt with. And they're going to look for a place that can give them information, can listen to them, and can guide them in some way. If we can show them and teach them and utilize this with them and say, okay, let's look at this. And I get how this feels good. And what else can be going on here? And could something else be happening that you want to be aware of? And really teach them how to look at it a little bit more critically. I think it's, arming them to protect themselves as well, not just needing others to protect them when it comes to getting on social media.
I really love the analytical approach to social media. As a journalist, I wholeheartedly endorse that. That would be fantastic. I also want to remind everybody who's watching that we will be taking some questions. So if you have anything that you'd like to, ask our panel, please let us know. I would like to pivot towards other technologies that I think have been pretty helpful. The rise of telehealth throughout the pandemic. Now people, have smartphones. It's just been so many, a lot of the barriers to telehealth have been brought down, mainly with a lot of regulations. But I'd like to hear your thoughts on how telehealth has changed, how and where caregivers and kids can be part of, a counseling session. And I'd also be curious to hear how you engage parents or caregivers who maybe think that they don't need to be part of therapy or that you shouldn't talk about your feelings. I'm always curious about that because I think there's a lot of reticence that a lot of people don't necessarily want to admit to, but they do have.
Yeah, I'll start with a little anecdote about the first part of your question, in that I think moving into telehealth for mental health has been a godsend, really. I've been able to get access to parents who have been wanting to be engaged and just can't because of the realities of life. They're working and they're working multiple jobs and they have other kids to take care of and other responsibilities. Because of the introduction of telehealth, I had a mother join a parenting group, a much needed parenting group for this mom, while she was at her cashier job. She was on the phone in group. And that never would have happened before. And she was so grateful that we were willing to have her participate in this way. And I thought, oh my God, we can never stop doing telehealth after this. So I've seen so many examples of that where, we've gotten a slice of life now that we've known intellectually, but to really experience now what some of our patients go through and the families, and to be able to say, okay, let me help you figure out a way that's going to work given the life that you are living. And let's see how we can fit this in rather than stop everything you're doing in order to make time to come see us.
I'll just add something that we've done in Texas. So Texas has funded the Texas Child Health Access through Telemedicine initiative, and it's TCHAT. So the acronym is TCHAT. we're full of acronyms in mental health, I think. And so through TCHAT, we're able to partner with local school districts. So school districts are partnering with medical hubs, medical like institutes, regional hubs, who are able to provide behavioral health services through telemedicine or telehealth within school districts. So if a child has a referral or a counselor identifies a child with a need, they will refer them to the telehealth program, and they will be able to access those services through that regional hub. So that really has brought access to rural districts who may have a shortage of providers, and it can kind of bridge that gap, or for children or youth who just for transportation needs, or parents who are working and can't bring them to appointments. It's really allowed for access for so many people who otherwise may not be able to access it. So, programs like this where we're partnering with schools certainly has its challenges, because again, we talked about how schools are really under-resourced, and this does require some resources through the school as well. But it can just exponentially increase the access that children and youth have, and families too, because families can come in and access services as well that they may not have otherwise been able to access, and really be a part of their child's treatment as well. So there's some really exciting and cool ways that technology has helped really bridge those gaps. And I'm just excited to be able to share about that, and hope we can continue.
And I know there was another part of your question about engaging families when maybe they don't feel that they need to be engaged. And I think that it's one of the most important things well, there are a couple important things. I think destigmatizing mental health is really, really important. A lot of parents are not necessarily wanting to engage because they feel like it's something to be ashamed of, that their child is having a mental health difficulty. And I think we need to recognize that mental illness is an illness. Would we be ashamed? Should I be ashamed that I take cholesterol medication? Well, no, it's a fact. I do that. It's something I need. And so I think that the more we talk about it, the more we share information and show people it's okay to talk about it and nothing's going to change. No one's going to look at you differently. But the other part, and I was really pleased to hear this last night in the State of the Union, was that if we look at mental health as being as important as physical health, so parents might be less inclined to not think it's necessary to participate in a child's doctor's appointment if there were a medical, physical health issue going on, right? And mental health is the same way. And so if we can look at it as being as important, studies have shown that proper mental health care can help improve physical health. It can help impact the likelihood of physically risky behaviors. It can help cause less likelihood of long-term illnesses, improve academic achievement, school performance other than academic achievement as well. There's so many areas of life that it can impact. We can't look at mental health just in isolation because it impacts everything. If our kids are worried, if they're anxious, if they're not able to think clearly, there's something else going on, they're not going to be able to engage in really anything else or a lot of other things that are going on in their lives. So let's treat everything and look at this like if they have a stomach ache, they can't, engage. And so we need to really equate the importance of mental health as well as physical health.
And on that note, I'd just like to offer that one way to do that, and one way to normalize mental health as part of physical health, would be to support integrated health in a primary care setting. And so really empowering pediatricians and primary care providers to screen for behavioral health needs, and then empower them to know what to do with it. And so to have referral sources and have the support that they need to treat mild to moderate mental health needs in a primary care setting. We have a program in Texas called the Child Psychiatry Access Network, which again partners with these 12 regional hubs that are affiliated with medical schools that allow pediatricians who are enrolled with CPAN to call the regional hub and receive consultation with a psychiatrist, with a child psychiatrist, about the treatment needs of the child or youth that's in their office. So within 5 minutes to 30 minutes, they'll be able to have a call back from that psychiatrist and have some treatment recommendations, some referrals in the community where they're located, some support developing a treatment plan, and some like ongoing support in terms of whether medication needs to be prescribed, or how and what to watch for, when to follow up. We know that pediatricians often don't screen for behavioral health needs because they aren't child psychiatrists, and they often don't have the resources, know of the resources in the community to offer families that may have a need. So what we're trying to do is really provide the support to the pediatricians that they need, because they want to address these. They want to provide this comprehensive care, and they're capable of doing that with the support that they need. So that's one way to do it, and with the hope that pediatricians can begin serving children and youth with mild to moderate mental health needs in their practice, hopefully that can free up some space in our outpatient specialty care network, and perhaps relieve the burden to a degree on the provider shortage that we're seeing.
I think there's also a complexity related to cultural factors and what mental health or mental illness means in different cultures. And it does require for the providers to take significant time and effort to help families understand what we mean by it, but also for us to adjust what we're seeing and what we're saying and how we're explaining it to families based on what their perspective is. So, it can be very scary. The thought that your child has something mentally wrong with them, emotionally wrong, you can't see it, there's no clear fix for it. We've got to recognize that could be very devastating news for a parent, even if it's something, for us, it's as simple as it's depression, it's anxiety, and I can give you an evidence-based treatment and you'll be fine. But to get to that point is going to be quite a journey for some families and parents. And if we can understand that a bit and take a step back and slow it down and help understand why they don't want to be involved. And do they remember being children? Chances are you're going to find that there is some memory that they're not wanting to come back to, or there is some experience that they've had that's making them so much more hesitant to take part in anything related to mental health treatment at this point. If we give them a chance to tell us about this and understand that and approach them with the sensitivity that requires, we usually have better luck at bridging this gap.
We've talked about some great, solutions sort of oriented stuff already, with telehealth and other things. Before we move to a couple listener questions, I was hoping we could maybe just, hear of other things folks have heard about. I know in California, there's been talk of fast tracking thousands of mental health professionals, getting them licensed, to the degree that they need to get into schools. Is something like that the answer? Does anyone have any thoughts on other solutions, other things that we can do now to address the crisis that everyone is, so loudly ringing the alarm about?
I have some thoughts, but I do want to say that there's not an easy answer to that, because if there was an easy answer to that, we would have solved it already, right? I think that a lot of people, and there's a lot of talk about money being out there for fast tracking these clinicians to go into schools and adding all this mental health support, a lot of it one-time money. And that is, while it's appreciated, it's better than nothing. We want to see a long-term commitment to supporting the mental health of our youth. I do want to say that I have a lot to say, and I'll try to keep it shorter because I know everyone else probably wants to say things too. But there are people in the schools that can do a lot of this work. We have school-based mental health professionals, school psychologists, school counselors, school social workers that can do a lot of this work. And so I think the importance is in valuing these people and the things that we can do. We're not just people who test kids for IEPs. We're not just people who create schedules so a child can graduate. There's a lot that we can do, but it would be up to districts and leaders in the state and nationally to really recognize the importance and recognize all that we can do. When we look at sort of a tiered approach, so we can do things within the classroom. We can employ social emotional learning that is either directed by a school-based mental health professional or things that are easy for teachers to use. Those are things that can be done with all students. In LA County, there's a program called TEAL that stands for Technology Enhanced Arts Learning. That is amazing, that uses arts to improve the learning, as well as incorporating social emotional learning strategies that are culturally recognize different cultures, and that's amazing. So those are things that can be done with all students. And then you look at some students who have maybe a higher level of need. that maybe could be in groups or could be seen by these school-based mental health professionals. And then if you're working with all the kids and then some of the kids, then hopefully they will get the help they needed so that there are less kids that then need to be referred to the clinicians who then can do their work, and maybe there's less demand on them, and they would be seeing those students with a higher level need. So that's, I mean, in that's sort of a big picture of what can be done within a school system. These school-based mental health professionals are trained specifically to work within school systems. And so you wouldn't necessarily, if someone is having some heartburn, you might not send them to a heart surgeon right away, right? You might give them some other types of treatments and work on other things before we use up all those other resources. So it's something to think about. And I'm sure that Shilpa and Tegan have other things that they want to add to this.
I have to agree with you. I think, Tegan, you mentioned integrating into primary care. I think for children, you have to integrate into schools. That's where they spend the majority of their day. That's where so much learning happens for them. And that's where so much of the support needs to come from. And we have a school model across this country that has all of these professionals. We're taught in school psychology programs, we're taught to do school consultation, but find me a school district that actually allows for school consultation to happen. It's unbelievable to me. We've got, as Stephanie's saying, professionals are trained to do a tremendous amount of early intervention and prevention in schools, but we're not allowing them to do it. And instead, we're just kind of pigeonholing them to do these assessments or very kind of specific tasks that really can't generalize in any way.
And then there are also so many barriers that are between systems. So for a school system to partner really well with a community outpatient, service provider, there's so many barriers to the coordination that needs to happen for that to be really effective. And so even trying to, and that varies from community to community and actually district to district too. So even setting up, one model that might work in one place may not work in another because each district has, different policies. But really, I guess what I'm saying is trying to make it easier for school districts to partner with community-based providers, whatever that might look like, I think would be really critical, because then the school district, to Stephanie's point, can do what they do really well and can do the service, provide some services, what they can do in-house, and then can partner with those community-based providers to do the things that are out of their scope or beyond what they can provide within the school system.
I'm curious. I mean, I grew up in Colorado, and Columbine, for example, happened, when I was in elementary school. So there was always a lot of talk about having mental health in schools. I can tell you, in my entire education, there was none. Even after something as huge and traumatic as that really highlighted this. So, I mean, fast forward now, right? We heard the president talk about it in the State of the Union address. We really have a focus on mental health right now, probably because a lot of people experienced, some sort of negative mental health during the pandemic. I don't really know how you couldn't, but I'm curious, like, if there were, until the focus shifts. I mean, we have, for example, a war in Europe going on. But if it turns to climate change or whatever it is, I mean, mental health really seems to be front of mind right now. What would you like to see happen before the focus moves on to something else? I mean, telehealth and mental health parity, for example, have been things we've been talking about for years, and it kind of feels like people are finally paying attention. I know this is a big question, but I am curious, because it really is, the one time where you hear it in I mean, I can't remember the last time you heard it in the State of the Union.
That's true. That is a really big question. So I'm not sure how to answer that. What it is that I'd like to see. I guess the thing that I'd like to see is for the conversation not to go away, because it's like we said, it's been part of I'm in the mental health field, so it's been on my radar for as long as I've been practicing, and before that, because again, we're all affected by mental health. So I was affected by mental health growing up, and I think that that's something that sort of shaped my worldview and I recognize that other people have been affected by it as well, more so than we're talking about it. So we're talking about it right now, and I think that's brought it up to the national consciousness. But I hope it doesn't go away, because we are going to continue to be affected by mental health, because whatever the next thing is that we move on to will affect our mental health as well. So I think this is a conversation that we need to keep happening, and we need to keep focusing on the solutions and following through on these really great ideas that we want to implement, and really supporting the implementation of these great strategies that we're proposing, because that's I think what will make the difference in the long run.
I totally agree, and I think that seizing this moment, using this moment to destigmatize mental health and have people having the conversation and trying to turn this one-time money that a lot of schools are getting into long-term investments. I know that our district, for example, in Whittier, we were able to hire a lot of additional school-based mental health professionals, and our district has made a move to making them permanent. So even though it was one-time money, to really instituting this. I think the other thing is, as we're coming up with strategies, having some accountability of really looking at not just throwing a bunch of things and seeing what they to the wall and seeing what sticks, but really looking at what is working, getting back to the table. Okay, how is this working? Why is this working? How do we need to tweak it? And really having that back and forth and really evaluating what we're doing, and so that benefit becomes routine. It becomes part of just what we've always done or what we do. And then maybe if the attention dies down, we already have it implemented as part of a regular process that we have.
One thing I can add to everything that's been said is that we need to trust in prevention efforts and stop being so reactive after things happen. And that's hard to do because you don't see the problem and people don't want to put money after something to prevent something that hasn't happened yet. How do you know you've prevented it? But we do know that it works, and we know what kinds of things can prevent things from getting worse and from risk getting worse, especially in children and teens. And it's not a big leap to say if we can catch it early, we can prevent it in adulthood as well, to some extent. And I think we just need to understand that children grow up to be teens and they grow up to be adults. And if we can start early, we can all be better.
So I double down on that. And I totally agree.
And I triple down on that. And a lot of my work of what I do is suicide prevention. And I mean, you said it so well. It's intervening early before it becomes a big problem. Talking to your kids early, talking about mental health, talking about suicide. A study was done that showed that by the 3rd grade, the majority of kids knew about suicide. And where they heard about it from? Media and their friends. And I'm not talking media about like healthy conversations like this. I'm talking about, television and movies. And so where do we want our kids to hear about it? From educators, from healthcare professionals, and from their parents, who can give those healthy messages and show that there are open lines of communication.
This hour has really flown by, and I have a lot more questions, and I'm sure Jackie does too. But we also wanted to get to at least a couple listener questions here because we've got some great ones. Julie E says, how do you think parents are coping during this pandemic? And how has their own stress impacted their children?
Well, I will say, as a parent of a young child, of a 2-year-old, it is really hard. It's been really hard, and I think that maybe this is coming across my feeds a lot more because of the stage of life I'm in. But hearing lots of, parents are really struggling. It's hard to navigate your own anxiety along with trying to help your children feel safe. And we know that a lot of caregivers have lost their employment, or their employment has changed, have difficulty paying bills, maybe had to move. So there's just a real struggle to be able to take care of yourself and take care of your children. And I think Stephanie and Shilpa both said it said it really well, is, wanting to make your children feel safe and have age appropriate conversations with them. And when you're struggling on your own, and most caregivers are, it's really hard to dig deep and find the resources to do that. So I think, the more we can support one another and create that culture of care and that culture of support, within our own communities, I think the better off that we'll be.
I think one thing I've seen, just to add a little bit to that, is surprisingly, when parents have been struggling, and I've seen a lot of parents struggling tremendously, being honest about it with their kids has made it easier for the kids who are also struggling, particularly through the pandemic. Having this shared experience has made it easier on the kids, actually. So parents, don't fret. You're letting your kids know that you're stressed. Yeah, it might be stressing now, but on the other hand, it's also comforting them that you're getting it as well. You get some of what they're going through.
Right. And the other part of that is that kids are like little sponges. They absorb everything. They see everything. And so if you're not honest with them, they might assume the worst thing.
Yeah.
And so that honesty is so important, and it can be a shared, we wish that parents were not having to experience this, but it can be a shared and bonding experience.
We got another question from a listener. Do we have any data surrounding the impact, I guess, of the pandemic on kids' mental health? For example, they list school shutdowns, masking, or secondary effects like lack of socialization in movie theaters or restaurants. I haven't been looking for specific data-based studies on that, so I'd be curious to hear what you guys have to say.
Yeah, I don't know of specific data. I just know anecdotally that it is having an impact, just because we hear about it from pretty much every kid I've worked with.
Mm-hmm. They're also asking if there were reports of there were some concerns early on in the pandemic that child abuse would climb because children may be around abusive family members longer, and out of a school-based setting where they were maybe monitored a little bit, well, obviously more by people outside of their home. Is that been something that you've seen?
I'm going to say yes.
Okay.
I can't, I don't want to get into too much detail, but unfortunately, yes. And I think, that the silver bullet you're referring to about coming back to school, at least in my case, given that we're an intensive treatment program, it was a silver bullet. We needed everybody back as soon as possible to be able to give the kids a chance to get some relief at times. And also just get relief, meaning for what their own struggles are. They were isolated at home, not being able to get their needs met. And so I do think that the stressors were higher for a lot of people.
And I'm aware that there was an increase of numbers of calls to hotlines, for example, some suicide prevention or crisis hotlines, an increase in the percentage of calls that centered around that topic as well. But then it's hard to know what hasn't been reported, right? And I think the fear was things were not going to get reported because they were isolated and they weren't able to have private conversations when they were engaging through distance learning. And so unfortunately, we don't know what we don't know.
Well, there were also problems when professionals would try to report. So, there wasn't really the sense that things would get investigated in the way that they were before.
This has been a really fantastic conversation. We have more questions and we wish we could go on longer, but we do want to be respectful of everyone's time. So, just wanted to say a huge thanks to everyone for joining us for this conversation on child mental health and the pandemic. Thank you to our panelists so very much for their time and expertise. Thank you to Jackie and my editor, Oscar Garza, our events team, Tony Federico, Rebecca Stummy, and John Cohn. You can find more of Jackie and my reporting at LAist.com. Again, thanks everyone for joining. Stay safe, and we hope everyone has a good night.